Yeah, it is a coronavirus. Like 414 and the lockdown is officially over. And however, the stay-at-home rules is still in effect. And it is like the day 24 out of stay-at-home rules. However, okay, so today the coronavirus cases are luckily have been reduced. Currently at 3,369 coronavirus cases, and so Toronto weather was okay in Toronto. I went Toronto shopping in Toronto for groceries. Yeah. Anyway, that's currently they're still in a deep in a troubling cases with 1,050 cases, somewhat lower than last previous cases. Pure Region is in the high cases with 819 cases. 286 is from York Region. 158 is from Ottawa, and 157 is from Durham Region. Durham Region and Ottawa have been on this list several times already. So 29 deaths have been reported today. So the official death toll is so of course I'm going to talk about variant cases as usual. So variant cases are all UK variant cases are almost at 70,000. Currently clocking out 69,442. So it's like that, like really close to 70,000. And it is our first main threat, which is increased, which has increased unfortunately by 3,482. Also yesterday it increased by 3,000 plus, and it is just disastrous. So 281 South African variants, plus increase of plus 7. 772 Brazilian variant, which is a plus increase of plus 127. And there's we don't know but apparently the last number of the India double mutant variant was at 36, but since they're doing a terrible job trying to take care of things, and obviously they're thinking it's not a threat. But if they didn't really look at what happened in India for like the past few weeks, yeah, because India has dealing with the India double mutant variant cases, and like 300,000 daily. So like that's way more serious than we're ever dealing with right now. And cremations had were involved, and lots of people died. Well, and the Ontario government did not consider it did not do the same thing they did for the other variant, and they then labeled it as very concern, and I still think they're doing a lousy job. And of course, the flight ban, that's not going to stop anything. Because if they might ban direct flights, but as I mentioned before, Indians or Pakistans could possibly go on connecting flights and go through airports like Incheon Airport in South Korea, Beijing Airport in in China, or the Tokyo Airport in Japan, or yeah. And then they could which literally connects to and the flights from there go to Canada, and the virus and more coronavirus cases end up here. So obviously they didn't think about that, and even though Ontario Premier Doug Ford and Brampton Mayor Patrick Brown, and who is also concerned that because some of the India double mutant variants have ended up in Brampton, so of course it's his job to take care of it. So yeah, he's really trying to get people, essential workers, vaccinated, and also flight rule change, but apparently the federal government ain't listening. So yeah, I'm on their side, and that I just think they're doing a lousy job, and they should do the same thing they did to the other variants, and actually provide updates on this. Now, you heard me mention about how they're not only they're transferring ICU patients from a hotspot area like in the Greater Toronto area, most likely the Greater Toronto Hamilton area, out west to London, hospital out west to London, or up north to Northern Ontario, or out east to Kingston, Ottawa, and of course there was the issue with the Ottawa one because yeah, and remember. Please remember, they're not doing this with consent with the patient family or patient. They're just yeah. And you think, oh, there's like we have no room, and then yeah, they literally. But this costs to actually send a dead patient's body back It can't be over $1,000. Just saying. And I just think with the government not actually trying to help out with the families who have to pay such fines. Well, shame on the government for not doing that. And also, they're all sending patients to long-term care homes. And this has got concerned a lot. And I got a message concern from long-term care homes. So this is what they have to say. So so Ontario that neglected long-term care sector that need sweeping reforms to protect vulnerable residents and the long-term care homes are blaming the government for thousands of coronavirus deaths at the province's nursing homes and not so. So the Ontario government has province has failed to learn from the previous SARS epidemic in 2003. And they should have heeded expert advice. Because there have been almost 4,000 long-term care residents and 11 staff have died of coronavirus cases since the pandemic, since March of last year. And so also what happened, some issues were poor facility design, resident overcrowding, heightened sickness, and deathing in nursing homes. So according to the commission, and there's also a severe staffing shortage and and of course there's the workforce poorly trained in infection control measures. Compounded to this the coronavirus. So the hospital in the hot spots, they're literally just sent these patients to the long-term care homes and literally sent their problem to them, and also made it their problem. And not every person at a long-term care homes were being treated properly, and that is actually the issue right now. So there's a recommendation to improve long-term care homes in the future, similar to for privately funded hospitals, courthouses, and light rail transit systems. And of course, the government that they made the mistake of so scientists and the doctors, local public health officials, and even the minister of long-term care homes. So like yeah, we warned them, but they didn't listen. So and there's also like workers who were talking about like to the government that the government repeatedly ignored the warnings of yeah. And also, so apparently at the long-term care home that they're like trying to like they're trying to like take care of like long-term care home patient and putting themselves at risk. And of course, they were trying to like make a protective equipment out of pop bottles and plastic bags because apparently regular masks were there was a shortage in supply and some would just cry and before and after shifts they would like vomit in lockers because of stress. So they were basically like freaking out, similar to like the nurses in hospitals had to have in critical care nurse ICU is going through right. So and there's so no wonder long-term care home residents and also staff taking care of these people are going through like an epic like hell right now, trying to survive or trying to take care of patients in these places, residents and then even though some people are like just like oh, I feel sorry for your family and trying to like give out condolences, that's not enough. Action needs to actually happen. Like improvements need to be actually made to these places and also of course the overcrowding, of course that was it. For the first start, that was it was definitely a stupid idea. They were ever to do such a thing because they're like literally making someone else they're trying to cut away some of their own problems, and by giving it to another places and making it, and which ends up making it their problem. And long-term care homes out there, yeah, they've like been suffering the worst, and also in second, we're also suffering the worst in ICU. Nurses, and also critical care ICU nurses. And I've heard stuff from Humber River Hospital in North York, and it was. I just feel sad for that they have to go to deal with such problems like this, and it's not their fault that they have to they have to deal with these problems, and patient transferring that should not have happened. So maybe they should have contact the patients or let the patient know firsthand that they would be doing it. So that's also another fatal flaw. The Ontario government that it was not doing. And of course, it's nice that we received the help from our Red Cross and Canada's military, that doctors and nurses, but I don't know. I feel like it's just affecting the Red Cross and them too, and the military nurses. Yeah, they got a job, and I'm quite sure that helping ICU nurses was in Ontario was not in their plan. So, if you want to get vaccinated, you know the requirements. If you want to book online, which might stop you from yeah, you have to be somewhat at the middle of May. I think it's 30 plus. Then they'll accept you, and then by May 20th, if you're 18 and up, they will allow you. Anyways, the website's COVID-19 ontario.ca/book vaccine. Click on the link if you want to call. Call 1-888-999-6488. So, but if you get recommended by a doctor, I realized actually, so yet they don't accept you. You have to get vaccinated at your pharmacy, which will take a while. So I considered either you wait or you're trying to book at your local pharmacy with the AstraZeneca vaccine, or you could wait until your age group is until you're eligible, and you can get actually shot by the Pfizer BioNTech vaccine or the Moderna vaccine, which actually is more effective than the lousy and AstraZeneca vaccine. Yeah. So I think I'm gonna wait, because I do not want to have to wait at a stupid pharmacy that's gonna make. Yeah, some people have not got lucky. and apparently the website has not let me. Yeah. FYI, if there's any gatherings or anything like that, and of course there should not be any. So enforcement officers have the 100% authority to break up any gatherings, and their fines will be given out at $750 plus a $130 surcharge, and organizers will be charged as $10,000. Hospitalization that is now at 21552 people hospitalized with coronavirus, minus 49, so that's slightly better. And a new drastic record of 900 ICU patients. I really feel bad for the doctors, the nurses in the ICU right now. And 637. Also another new record of ICU patient using a ventilator. Oh God. Oh. And of course, they're trying to, the Ontario government's trying to be shady, and they're not showing no report or outbreaks. I tell you, they're being shady. So I just hope that long-term care homes they force the government to showcase numbers and outbreaks, and also make things better, because long-term care homes staff are also struggling the same way ICU nurses are struggling, and the ICU section of the hospitals. So please follow coronavirus safety rules and regulations, lockdown regulations, and stay-at-home rules. Don't have any gatherings. So follow Ontario and Quebec border rules if crossing for essential reasons. Remember, your rights aren't more important than the rest of us. And try to lower coronavirus cases and ICU patient numbers. And the people I'm talking about is the ones who are having large gatherings when they should not be. So, starting May 6th, we'll most likely go back to color zones like we did with after last time. Stay safe.